Last hour, the President declared a national emergency. This is an important step, and we will work to bring every resource available to us into this state. But make no mistake, we have long since passed the moment when we thought we could count on the federal government to lead in the face of this unprecedented situation. Here in Illinois, we are doing everything that we can to keep transmission rates as low as possible, to flatten the curve for our healthcare workers and our first responders, for our most vulnerable populations and our older citizens. And we're working with other states and with federal officials to ensure that our national mindset reflects those same priorities. It's with that in mind that I have determined that we will close all K-12 schools, public and private, statewide, starting Tuesday, March 17th through March 30th. This is the timeline that we are laying out today. Let me be clear, I understand the gravity of this action and what it means for every community in our state, as well as the families and caretakers of the 2 million students that gather in large groups every day in school classrooms and assemblies. None of the choices that we have to make over the last week, or have had to make over the last week, have been easy or simple. All of these choices have cascading effects for citizens and vulnerable populations when it comes to food access and safety, childcare, and social services. It's my job to weigh the benefits and risks of any one particular course of action and to come to the best possible conclusion. This is the right thing to do, to protect our students and their teachers and school workers and parents. The Illinois State Board of Education will be fully staffed over the coming weekend and during the closure period to help district administrators work through individualized issues and challenges in each community. The Illinois Association of School Administrators is convening a team of experienced superintendents across the state to serve as a resource and as a conduit to my administration for issues that arise as a result of this directive. I want to thank the superintendents, the ones that are standing with me today and all across the state. Dr. Courtney Orzel of Lamont Brombarrack School District 113A standing with me. Dr. Kimako Patterson of Prairie Hills School District 144. Dr. Brian Harris of Barrington District 220. And Dr. Mike Lubelfeld, North Shore School District 112, and superintendents across the state for their courageous leadership during these difficult times. Our State Superintendent, Dr. Carmen Ayala, is here today to talk more about this decision and our plans to remove certain state mandates during this period in order to offer more flexibility. Let me be clear. No school district will see their state funding cut as a result of this public health crisis. I want to address the first consequence that will come to mind for so many: food access. Our State Board of Education has received the necessary waivers to continue to distribute 2 meals a day to children who qualify for free and reduced lunch through a combination of delivery and parent pickup meal options. ISB is working with local school districts across the state to develop guidelines on how to best distribute meals across the community in a safe and healthy manner. We're also working directly with the 8 major food banks across the state, as well as food manufacturers, to ramp up capacity to serve our most vulnerable children. I know a lot of people are wondering, why schools, when we know that children seem to be less susceptible to COVID-19 than other populations? But this is a critical part of our larger social distancing efforts. In addition to kids with immunocompromised conditions, we have teachers and administrators, parents, and the larger population to consider. I'm speaking in the very literal sense when I say that having the general public stay home 1 day at a time will have a massive effect on bending this curve, and that means lives saved. We have seen positive results in countries that took aggressive action, and we have seen the tragic outcomes in countries that did not. There are things that you can do to assist your neighbors and your friends and your family. The people of Illinois are a creative and generous and caring people, and I'm asking everyone to help in these challenging circumstances. So please, this weekend, if you can, stay home. If you are able to telework, do so. If you don't have to travel, don't. This isn't forever. This is a sacrifice in the short term to help our hospitals, our healthcare workers, our testing laboratories, and our vulnerable and elderly residents. We all have a duty to each of them. Everyone will make a sacrifice, but of course these sacrifices run deeper for some residents more than others. I'm working to do everything I can to help our working families during this unprecedented national crisis. Already we've filed emergency rules granting workers who are unemployed due to COVID-19 access to unemployment benefits. I'm reaching out to the heads of all utility companies around the state to maintain services to all Illinoisans, regardless of their ability to pay. Additionally, in collaboration with Attorney General Kwame Raoul, I have requested the Illinois Commerce Commission initiate an emergency proceeding on a moratorium on shutoffs and changes to payment and collection policies to ensure that Illinoisans aren't saddled with debt if they're unable to pay their bills during this crisis. I'm continuing to press the federal government to massively scale up our testing capacity as a nation. Here in Illinois, our Department of Public Health and our hospital partners have developed a robust testing capability and are ramping up to sufficiently test weekly to accurately surveil our state population. But we need the federal government to step up and provide the necessary support for that effort. On that note, I want to be very clear. Not everyone is going to need a test. We have to prioritize those who are sick enough for the hospital and our elderly residents and individuals who are otherwise immunocompromised. We will all be better off if our healthcare workers have first access to those tests and to all personal protective equipment. Please leave the masks for those who need them. It'll protect you more in the long run. I know this is hard. I know people are scared. But most have never dealt with anything like this before, and it's easy to let rumors take hold and let fear drive us. I will continue to be fully honest and transparent with you. Every action that we take to control the spread of the virus and prevent our medical infrastructure from dealing with too many cases at once is an action that impacts and disrupts lives. And all of the evidence that medical experts have provided us is that even 24 hours can make a difference when it comes to the timing of these decisions. I will not have us look back after we are through the immediate challenges and say that we didn't take action soon enough. I will leave nothing on the table when it comes to protecting our communities. We've seen what happens in places that didn't move quickly enough. I ask all of you not to hesitate to do the right thing for your family, your friends, and your community. One small step at a time. We will get through this together.